This is my patient screening form. It's a female for a brain with and without contrast. This patient has a pacemaker and has their card with them. They've had no problems with a previous MRI exam, no injury to the eye, never been injured by a metallic object. They're not taking any medications. They're not allergic to any medications. They have no history of asthma, allergic reaction, or reaction to contrast. They do not have anemia or any other disease. They are postmenopausal. They're not pregnant, not taking oral contraceptives or hormones. They are not on any fertility treatment and are not breastfeeding. This exam is on a 1.5 Tesla magnet machine. They have no aneurysm clips. They do have a cardiac pacemaker. No other implants in the body. They do have a medication patch, which can be nicotine or nitroglycerin, and they have dentures or partials and tattoos. So before an MRI exam, dentures and partials should be removed. Tattoos are generally safe to enter the MRI machine unless they are fairly new because they will have increased sensitivity. And older tattoos can have a risk of causing mild burning or tingling due to the ink that was used. So technologists just monitor the patient for signs of burning or an uncomfortable feeling with their tattoo. Medication patches should be removed before the scan also, because if the patch is left on, it can cause burning on the patient's skin. Requirements for an MRI for patients with a pacemaker require research to determine the condition of requirements by looking at the model and the design and checking to see if the pacemaker is MRI compatible. The patient might also have their pacemaker card with them, which will have the model and serial number, and you can use that to look up the kind of pacemaker the patient has and how it should be programmed into the special setting before their MRI scan. And patients should be monitored during the full exam. Some special considerations for patients with a pacemaker is to know that older pacemakers may not be MRI compatible, and alternate imaging such as a CT scan may be required for these patients since there is no magnetic field. Other risks include heating of the pacemaker, changes in the pace, which can cause an irregular heart rhythm reading, and interference with the electronics inside the device. Radiologist approval and clearance is needed for patients with a pacemaker because they can confirm that the device is safe. They know that the magnetic field can affect the pacemaker settings, so they will have to agree that the MRI exam is still the best option for the patient. And the radiologist will want to ensure that the MRI is performed in a 1.5 Tesla magnet machine. In conclusion, this patient can proceed with the MRI scan once their dentures and medicine patch are removed, the tattoo is considered safe, and the pacemaker is on the correct setting to enter the MR environment. The patient is safe to receive contrast due to no previous reactions or complications. The patient should be monitored during the MRI exam for signs of abnormal heart rhythm or unusual sensations such as warmth or discomfort near the site of the pacemaker. And it is important that the pacemaker is set back to its normal setting once the MRI exam is complete, and to be sure that it is operating the correct way.